this idea of science by consensus and offset, loading off expertise or considering the experts of folks that are in these fields and saying, well, I don't know as much about it. So I'm going to, what do the endocrinologists think? And I think that there was an element of that. When I came up through medical school and residency, we were very evidence-based, looking at real studies. And I don't remember really any activism. I mean, it was, scientific discovery was always happening. And we had some humility, I want to say, at that time, that maybe everything we're doing is not exactly right. We're always in a mode of discovery, and scientific process actually requires people to ask the question, is this doesn't make sense? Do we need to look at this more? And we change our recommendations or what we or how we see things, how we treat things pretty regularly in medicine, because as more information comes to light, we naturally need to make those, we can't just live by dogma alone. But yeah, there has been an offset, and the W path is not really a truly scientific, this isn't scientists working on the bench.
That's
right?
An understatement.
Okay, just to be clear, this is a clearly activist organization. And I don't have to tell you, you probably know all of this, but using the W path and then other organizations, medical organizations like the American Academy of Pediatrics and the AMA and the endocrinologist societies as evidence for how we should treat people, how we should treat children with this very complicated disorder, which is, these kids really do need help. I mean, we need to be treating these kids with the utmost compassion, but also with the idea that we want to make them better. We want to heal them. We want them not to suffer, and that takes constant discovery, especially for new things on the block.
Joe, let me jump back to you on this issue of professional consensus. It was jarring for most of us when we saw how quickly things turned, and then you had these multiple professional organizations, the Association, for pediatricians, and the American Medical Association, all these coming out recommending these types of awful things, things for kids. You talk about in your report about institutional capture. There's clearly an agenda here on the radical left and far left to use these professional organizations to promote gender ideology. What did you learn about how institutional capture happens at organizations like the TMA?
Well, I had a theory in advance about, how, like a working theory of how capture works in organizations. And the HHS report on gender dysphoria actually has a section on medical societies and kind of explains that what tends to happen in areas of like emerging medicine or very highly, like which gender affirming care is like a highly specialized kind of novel medical field, is that organizations often defer to these kind of ideologically insular subcommittees and kind of defer to their expertise. And I think the TMA situation was a good example of that, where basically the organization was allowing a group of people an LGBTQ health section. They were seen as the de facto experts on affirming care, and they basically were put in positions through being on committees, councils that are reviewing evidence, making recommendations to the House of Delegates. I would say they have disproportionate influence to kind of shape the organization's policies on affirming care.
Is it just the silence of the good people? Because, Dr. Ehrlich writes in her piece that the TMA was elevating gender-affirming care as a centerpiece of political advocacy, even though only 1% of members ranked it as a top priority. So did you find that, the silence of the good people or people who did not agree with this just because they weren't part of that section, they were deferring to them to avoid conflict, or what was going on internally?
I think there's definitely an element of that where members are implicitly scared of voicing their opinion. And part of that is, I think, due to the organization's stance in general on affirming care, where it's often, well, not even often, it's explicitly contextualized as, you know, an extension of civil rights, where the TMA has another policy on non-discrimination in healthcare, and gender identity is a category that's in there, and they basically imply that, you know, not offering affirming care is inherently discriminatory. And I think most members probably don't want to be seen as opposing affirming care and then being accused of transgender, anti-transgender hate or discrimination, whatever it might be. I think that's a huge part of it. And then I think another part of it is members not necessarily probably feeling confident weighing in on this area, because it is sort of unusual in a lot of ways, that they think it's just far outside their area of expertise, when I think if more doctors kind of use their normal training and judgment and applied it to the same issue, we probably wouldn't be in this situation.